to reduce my admin burden, save time, and ultimately improve how I practice medicine. I think most of us as physicians feel the drag of administrative work. I know for myself, I was spending often my days off either doing my MOA's work or I was charting. And so I would work my regular clinical days and then I would have my days off doing a lot of administrative work. Um, so I was spending lots of time on scheduling, on paperwork and follow-up. And I felt like I could spend that time, doing things that I enjoyed in my downtime and also just being more efficient seeing patients. So what I actually did is I ran a quality improvement project and I wanted to look at how much time my MOA and I were spending on various tasks and see if there was a way we could free up clinical time without needing more staff time. So I'm just going to run you through a couple of tools that I use that are part of Corticopes that have really helped me with my workflow. So one of the biggest game changers for me was implementing a service that's part of Cortico called Wave the Wait. It's a document triaging service. It actually uses AI to name, categorize, and route all of the incoming documents. So I get a lot of referrals, and that's a lot of time for my staff, but it also will do that for lab work, for pharmacy requests, for consult notes from physicians. So we had to train it. It took about a week or two, and now it basically runs itself. And the other big thing was my MOA, who inputted all this information into the charts. Sometimes she would make mistakes, and that would cause a lot of chaos because if it was the wrong email or the wrong phone number or even the wrong MSP number, we would find out the hard way and that would have to be corrected. So that really reduced our error rate to less than 0.3%. Before it was about 15% of the charts inputted had errors, and it did save my MOA about 6-ish hours a week, which was pretty major. And so this is an example of this is just a generic incoming consult note. So in red here are the parts that get automatically input. So this is Oscar, so it might look a bit different if you have a different EMR, but the document type, the description of the document, and then the demographics. So all the patient information is taken from this file and put into a new chart. So that's their name, their PHN, their date of birth, their address. So a whole new chart is made for them, or it's added to an existing chart. And then it will flag the provider, and you can teach it which provider to flag, which is really helpful. So once the chart is created, the way my practice works, and this is probably different for every doctor, is I have patients do a lot of their own booking because I was finding there was a lot of back and forth with my staff playing phone tag, trying to get a hold of patients, trying to book them in for visits. So what happens is my staff will send a booking link through Cortico, and about 2/3 of patients will actually book themselves. We were quite surprised by that. We thought it wouldn't be as popular as it is. And that means our MOA time for appointment scheduling has been nearly cut in half. So it used to be about 10 to 12 hours a week, and now it's gone down to about 4 to 5, which means I've been able to reduce my MOA's hours. She used to work 4 to 5 days a week, and now she works about 2 to 3 days a week. So this is just a video to show you what that looks like. So this is Oscar. This might not apply to everybody, but this is the Cortico plugin in the right bottom corner. So this is just a fake patient, but what the staff will do is they will press this book button on the right-hand side. Oops, sorry, my computer is going a bit crazy here. Here we go. So they'll press this button on the right-hand side. It'll bring you to a patient booking platform. And you can see here I have lots of different workflows. So if you're a GP or you do joint injections or any procedures, you could have those different workflows in Cortico can customize them. And so choose the workflow type. So this is just an example of one. Put in the reason for the visit. And then the nice thing is you can actually pick an expiry date, because I had a lot of patients who would just sit on these booking links for weeks. So we have it expire so that it pushes them to book an appointment sooner. So you can pick a date that works, and then you can set a booking range. So if you don't want the patient to book for 3 months down the road, you can set the booking range to that time and date, and then you press book, and it will add the patient in, and you press request to book on the left-hand side here. This is the Cortico page if anyone has Cortico. And you can see there's a list of patients. You can see that they've all had appointments booked. You can resend the links via email and SMS, and you can actually see if they've opened a link, and you can archive links once they've been done. So that's really simplified things for my staff. And then this is a really cool feature that I really like. I'm not sure if anyone uses AI dictation, but I use Heidi, which I find really, really great, which is basically listens to you talk to the patient, and then it creates a note for you. So for patients, I've actually added into my practice a pre-visit questionnaire and a photo upload step, because I do quite a lot of derm, but you could tailor that to your practice. And that means to actually book an appointment, they have to fill out a questionnaire about their medical history, medications, allergies, what they're presenting for, and they have to upload a photo of their skin, and it's all put into the chart. So by the time I see them, I actually have all of that information. And what I do for Heidi is I'll put all of the questionnaire info into the context tab, which is a tab where you can add in patient info. So when I'm having my visit with the patient and it creates a consult note for me, it takes all of that information into account, and it really shortens how much time I have to spend. And it also is great for medical legal reasons, because photos, you have a photo of a baseline skin condition in the chart. That's a nice backup to have. So this is an example of what it looks like from the patient end to book an appointment. So this is when they press on the link, they add in their date of birth. And then this is I also do migraine Botox. So this is a questionnaire example of what they would get. They would put in information about their headaches, how long they last, anything triggers their headaches. So you can customize this as much as you like. Press continue, and they'll get a list of dates and times. It's pretty simple to use. Dates and times available, which is helpful. And then press continue. They have to agree to any pre-booking stuff. And then another really great feature is they can select a pharmacy. It'll actually show them the dispensing fee, which I didn't know about until I tried it from the patient end of things. And then they confirm all their information, and that will actually pre-populate into the chart that's their preferred pharmacy. So that really simplifies all of that process. You don't have to have your staff chasing down patients to book, and they can choose which pharmacy they want to use. And then they get this next landing page where they can that you can put in custom information about the appointment. You can have them add things to their reminders. And then I really like this feature, the feedback part. If they're unhappy with the visit, they can give feedback, but it's only put into Cortico. But if they're happy with the visit, it goes to your Google reviews, which is a great way to improve your visibility online. Yeah, so that's the patient booking side of things. And this is what it looks like from a doctor's perspective. So this is the questionnaire that I just filled out that you can see. It's actually uploaded into the documents tab of your EMR. And so this is what I usually copy paste into my my Heidi AI. And then Cortico sends out reminders at various intervals. This really helps. Before I use the system, I used to have about 3 to 7 no-shows or late cancellations a week. And unfortunately, that would translate into a lot of money lost in revenue annually. And so that's dropped significantly. I hardly ever get no-shows now, which was a very frustrating thing for me before. And the other helpful thing is we can actually track when patients receive reminders and when they view them, including the timestamps. So if someone says I never got a reminder, we actually have a way to look at that. And that kind of accountability has really reduced patient conflict and also the scramble of trying to get patients in when you have a last minute cancellation. So this is an example on the right-hand side of the type of text that Cortico would send. In this case, it's a request to book, but you would also get reminder texts and emails, which is really helpful. And this is what it looks like on our end. So you can see these reminders, you can actually track when they're opened, when they're delivered. So if there's an issue with delivery, you can fix that and you can see when patients have opened their reminders. And then once a patient books an appointment, like I showed you before, they will enter their pharmacy information. And we have before my day, my staff will open up Cortico on the main scheduling page, and they will use a couple buttons to automate some processes. So one of those is there's a one-click button that adds all those pharmacies into the chart, so we don't have to manually enter them. And we also run an MSP eligibility check before the visit, so we're not spending time on patients who aren't covered. And that saved my staff a lot of back-end work because they had to manually check every single MSP of every single patient before. We used to lose about $800 a week from visits that were ineligible or unbilled, and now that's gone to zero, which is really, really great. So this is an example of that button. So it's on that right-hand side there in the scheduling page. And I just clicked that eligibility checker. Sorry, that went a bit fast. It was only one patient that we had to check. So it just says 1 of 1, but you can see on the bottom, it'll say the name of the patient. This is a fake patient without an MSP number. So they'll be flagged because their MSP is invalid. So on the bottom there, there'll be the name, the demographic number, and then the staff will have a list of patients whose eligibility didn't get checked. That's really helpful. And then you can also do the same thing with the pharmacies. So you press preferred pharmacies. It'll automatically load all those pharmacies the patient manually picked into their chart. And in this case, the pharmacy wasn't in the system. Sorry, I'll go back there. But I'll show you how that could be added back in. So I'll just show you what it looks like from the pharmacy side of things. So this is a fake patient. I'm prescribing them a medication. This is on Oscar. So we go to save and print, and this is the Cortico pharmacy module. So you can see this is their pharmacy that's being added in, and actually they've selected a different pharmacy. So the Walmart Uptown was the one they had previously, and then Joe's Family Pharmacy is the one they added when they booked the appointment. So you can actually select on the right side set pharmacy, and that will add the new pharmacy into their chart. And I do this for every patient because I don't know about everybody else, but I find there's a lot of back and forth with patients saying the pharmacy never received my prescription. So every prescription I write, I will actually text a receipt to the patient. So that's a direct messaging system. It just says that this clinic has sent the prescription to your pharmacy. It'll give them the name of the pharmacy. So they can actually show the pharmacist. I've had some patients do that. You can also email the prescription notification, and you can email the physical prescription. I know some patients want that, and that just saves you saving the PDF, adding it to your email, emailing it to the patient. So, and it's secure, so it's a lot faster. Yeah, so that all is really helpful. Everything's just saving lots of little clicks, which takes up a lot of our time. During the visit, we also have a way to send documents, messages, aftercare instructions through secure messaging. It's fast, and I really like that it gets logged into the eChart, so you can see when you sent whatever you sent, message, document, and whatnot. So it saves my staff a lot of time. They don't have to print things off, give it to the patient, or scan things in. And there's also a little extra billing feature in Cortico that bypasses the final screen in Oscar. So those are two things that just save me quite a lot of clicks and extra time. Seems small, but across a full clinic day, when you're seeing 30, 40 patients, it saves hours a week, which is really great. So this is an example of how you can send documents to patients. So this is again, the Cortico plugin on the right-hand side in Oscar. This is sending a patient some documents. So you can either send them these saved replies, so you can actually create these pre-made replies if you sort of send similar things all the time. This is just an example of one that's for our location, but you can customize that to be whatever works for your clinic. Or you can add a file or a document. So a document would be something that's actually already in the chart. So that could be like a result or a pathology result, or you can add an e-form, which is like a lab requisition or imaging studies. Or I think probably the thing I use most is these handouts. So I'll do a lot of biopsies and I'll send patients aftercare handouts or information about things like Accutane. You can either text them or you can email them, which is really helpful. And Cortico has different ways you can send information. So you can send it directly, you can send it securely, which is where the patient actually needs to submit a two-factor authentication. So that's really great for secure messages. And then there is a new function where you can actually message back and forth and allow the patient to reply. So that's really helpful. Okay. And then I'll just show you here, if we're sending this message to a patient and you press send like that, just show you how it shows up in the chart. Yeah, so that's it being sent. You can see the timestamp. And then in the actual chart, it'll give you the time and date and the form of communication. So that's really helpful if your staff hear back from the patient that they didn't receive something, or you want to see that your staff sent something, you can actually have a record of it in the chart, which is great. And then this is another helpful thing. I'm sure everybody has a hard time with patients no-showing or missing appointments, and how do you collect the money and all the friction and conflict that comes with that. So the way we do it at our office is, if a patient no-shows, of course, if there's a reasonable reason, I guess, that they didn't arrive, that's one thing. But if it's a pattern and we decide we need to collect a no-show fee, we will flag them. And the next time they try to rebook, the system will actually ask for a payment upfront via Square before it lets them continue with the booking process. And the system also lets us send things like doctor's notes or sick notes or insurance paperwork that basically we upload it and then it's locked until a payment is made, which is helpful. So it doesn't create this back and forth, like giving credit cards over the phone sort of thing. And it really reduces a lot of friction for our staff, and it makes sure that we're compensated for the missed time. So this is an example of how that looks on Oscar. So here we're in the master record of the patient chart, and we can change the patient status here to NS 100. And then we update the record. So that's no show 100. You can customize it to whatever amount you'd like. And then I'll just show you what it looks like from the patient's point of view to book. So this is a patient who hasn't shown up maybe multiple times for a visit, and and you're trying to collect a no-show fee. So they'll go through the process, they'll add in all their information, hit continue, they're trying to book an appointment, and then they'll get a notice here that they have an outstanding balance that they need to pay, and they won't actually be able to continue until they pay. So they'll go through this process, pay the fee, and then once they pay the fee, it unlocks the booking and they're able to book again, which is really helpful. Okay, and then this is what it looks like. Like I was mentioning, you can do similar sorts of things with sick notes or letters or disability forms where you need the patient to pay. You basically upload the document here and then set the fee, and you can add an invoice number if you need to, submit it, and then the patient will get an email and they'll be asked to pay a fee, and then the document will be unlocked after that. So they'll be sent the document. Great. So let's see here. Yeah, so after my QI project was finished, we did a calculation of the hours saved, and it was pretty mind-blowing. It was anywhere between 18 to 29 hours a week that my staff was saving, and we recovered quite a bit of money just from all those things. Like I said, the staff time, the collecting no-show fees, making sure MSP was eligible. And the biggest thing I think for me was all the time that I got back. So like I said before, I was spending pretty much all of my days off, embarrassingly, doing a lot of admin work, helping my MOA, sending patients book, information or just spending time doing paperwork that I really didn't probably wasn't probably my job description, but as doctors do, we sometimes take on other roles other than clinical work. So the big green flag for me with this whole thing was I was able to actually take like a day off. And my fiance joked that I was actually unchained from my computer for once. So yeah, that was really, really helpful for me. And I definitely think it was worthwhile implementing all these automations. So I've learned basically that automation only works if your workflow is solid first. So we mapped out all these steps. We were really lucky to have tools like Cortico and Wave the Weight to help implement them. And we still revisit this system because there's things 6 months ago that worked then but don't work now, and we always need to basically evolve the system as patient needs evolve. So we always are refining and testing and tweaking this whole process. And I found this system doesn't only help me practice better medicine, but it makes my job feel more sustainable. And I do honestly think it's made my burnout levels a lot lower, less likely to burn out as a result. And there are some more features coming, which is really exciting. I think the great thing about Cortico is they're very open to developing and listening to patients and physicians and what they want to create or hurdles they think that need to be overcome. So Wave the Weight is working on tickler automation, which essentially is in ticklers, which is a feature I think of Oscar. It'll be using OCR to detect words and maybe use those to send automated emails or messages to patients instead of MOAs having to do that. And the other really exciting thing is Cortico, from what I understand, is working on secure provider to provider messaging. And it's actually something that's being tested right now by a couple select clinics and physicians. And the thing that's really cool about this is I think it's going to be a really great way to send secure messages, not just from doctor to doctor, but hopefully healthcare providers like physios and pharmacists, and hopefully will make it easier to send faxes and messages that referrals and messages that you would normally have to fax, because the fax system is very archaic and very difficult and not always reliable. So that's something that's very, very close to being released from what I understand, which is very, very exciting. And hopefully I'll be able to integrate that into my practice in the next little bit. But yeah, that's my clinic's automation. So I'd love to hear everybody's thoughts, what you're already doing in your own clinics, if any of these pieces could be helpful or useful for your workflow. And if anyone has any questions about the details or nuances of this, yeah, feel free to ask me or Alfred or Matt.